insurance is going to reimburse you for. You can spend a few weeks in task 5, or you can spend a few months in task 5. So obviously with your cases that are that are complicated, maybe there's been long-standing depression, maybe there's a lot of chaos in the family, you'll probably spend longer in task 5. So what task 5 is all about is revitalizing a goal-corrected partnership. So Bowlby talks about this concept, that when there's a secure relationship between a parent and an adolescent, the adolescent looks to their parent for help and guidance. That even though in adolescence, kids spend more time with their friends, they still need to remain attached to their parents. And so this is about having cooperation emerge from a desire to maintain that connection. So both parent wants to cooperate with the kid and the kid with the parent. And the parents are now viewed as a secure base, the person or people that this kid can come to get support and help to navigate life. And we know a lot of stuff comes up in adolescence that are difficult to manage. So one goal is to have the parent become this secure parent again and be there to support the kid. We also see task 5 as good practice, right? So we started having this family use new skills in task 4, and task 5 is where the family really starts to build competency in these communication skills. So it's really when they start learning how to do this on their own. What you find is if you've watched a series of task 5 sessions in order, and you turned off the volume, and you watched the interaction and the body language of everybody, what you would see over the course of task 5 sessions is the therapist doing less and less and being less and less involved. And for me, I know I'm done with the family when I've set up the content of the task and I say, all right, let's start talking about it. And for the rest of the session, I try to make myself as small as possible and disappear in the room because the family's just doing it on their own. That's when I know we're done. We can do our termination, things that we need to do, and help this family move on. So this is also a time when we will bring in other family members. Right? So we might bring in siblings, if that makes sense to bring in siblings. We might bring in grandparents if they're around. Whoever it is that makes sense to bring in at this point is when we're going to involve other people in the system. It also might be another time when you need to mobilize other mental health services. So if you're finding a kid who could really benefit from some dialectical behavioral therapy, and that's not something you do, you could refer them out. Or substance abuse treatment or trauma treatments. So it's when you're also thinking about what other things and resources might this kid need that either I can offer myself or maybe I need to refer to somebody else. So there's a variety of topics that we talk about in task 5. So task 4, the topic is about the adolescent's relationship with the parent who's coming to therapy, or parents who are coming to therapy. In task 5, it's no longer about this relationship here, but about everything else.